My name is Jennifer Reid. I work for the Snohomish Health District. I'm a healthy community specialist, and my primary role is to work on tobacco prevention, especially for youth, which now concerns mostly youth vaping. So recently we released our Healthy Youth Survey results. The Healthy Youth Survey was taken by students in our county in October, and it measures lots of different health outcomes. And one of the questions that we're really interested in is people who currently use e-cigarettes and vapor devices. So we measure current use by past 30-day use, and we've seen pretty dramatic increases among all the grades. The question on the Healthy Youth Survey did not address the use of Juul products. So many teens tend to refer to Juul as something separate. They don't identify it as an e-cigarette or a vapor product. So I would suspect that the real numbers that we would see are actually much higher if we were to ask high school students and teens if they were using e-cigarettes, vapor devices, or Juul products. So here on the box you can see that it says 5% strength. So even though that 5% might seem low, one pod of a Juul is actually equivalent to about a pack of cigarettes. This here is what a pod looks like. You would pull the top off and insert it into your Juul device. Here is the Juul itself. It looks very similar to a USB, which is why it's so difficult for adults to spot. Many teens can come up with very creative reasons about why they have this or hide it very easily in their hand. This is considered a pod. You buy several of them, you use them a few times and then throw them away. This part is then inserted here and the user would inhale, start breathing right here. So this is very similar in style to the Juul. The one big difference is that it's even smaller. So you can see the size difference here. So this again makes it very easy for teens or whoever to hide it in their hands, to stick it in their shoes or socks, into their bra, into their waistband, and pass it off very quickly without adults or teachers, school staff finding out. You can see here the examples of just how the flavors are enticing to kids. This is Candy King. This here is a peanut butter and jelly monster flavor. So again, those are probably pretty enticing to teens because they like those flavors already. These over here are the nicotine salts. So these would go into your pod-based systems like the Sorin Drop here or the Sorin iShare. Again, these have much higher concentrations of nicotine because of the way the nicotine salt is developed. You can see here that it's 48 milligrams per milliliter versus this one here, which is 6 milligrams. Many people tend to think that e-cigarettes and vapes are safe for you and that they pose no danger. This is not true, especially for teens and adolescents. Adolescent brains are still under growth and development, and the human brain continues to grow and develop until the age of 25. What we are finding in a lot of these products, especially the newer ones that have come out in the last year or two, is that they contain massive quantities of nicotine. Nicotine is the addictive chemical that is found, of course, in all the tobacco products, in the cigarettes, in the chew, in the cigars, and it's really taken out and distilled down and put in very high quantities into the newer products that teens are using right now. If a teen is under the influence of nicotine or any other substance, it really makes it hard for them to fully engage in school and be present in the environment around them. So we really need to work with schools to set up good discipline policies in terms of what are schools going to do when they find a student with a vapor device or with an e-cigarette. How are they going to respond? And we need to look at it from both sides, from the prevention side of how can we prevent students from ever bringing these products to school or ever using these products, but also from the treatment side of if we do have students who are caught with these products or found to be using these products, how are we going to deal with that? What are we going to do? One of the most important things for teens no matter who they are and no matter how they're developing, is for them to have a loving, caring relationship with an adult. That can be a parent, that can be a teacher, that can be a coach, it can be a religious leader. It doesn't matter who it is. It's important that the teen knows that that person cares about them, they're interested in listening to them, and that they will help support them through all of their lives' developments. It's important that if you are that person for a teen, that you're aware of what these products are, what they look like, how they affect the teen brain, and that you're clearly communicating to the teen in your life that the use of these products is not okay and not acceptable. Teens are listening to you, they do look up to you, they do watch what you do and your behavior, and you can always communicate to them, in my house, my rules are no e-cigarettes and no vapor products.